Welcome to the Med Spa Method. I'm your host, Leslie Schweitzer. I'm a doctorate-prepared nurse anesthetist. I started my own medical spa in 2022 called Lush Aesthetic Bar. Over the past 4 years, the spa has been through a couple of transitions, and it's now called Lush Aesthetics and Wellness. These episodes are your guide to med spa treatments and wellness. Many of the episodes are just me talking about something I'm passionate about, but along the way, I will feature some guests that will bring value to the podcast. Thanks so much for being here. Let's get into it. Welcome back to the Med Spa Method. I'm Leslie, and today I'm going to flip the script, and instead of talking to providers, I'm going to talk directly to patients, or really I'm just going to share things that every injector, esthetician, provider quietly wishes that their patients knew. This episode is inspired by those Instagram reels that say, if I wasn't afraid to hurt your feelings, this is what I would tell you. So these aren't complaints about my patients. These are just truths that I want you to know about your treatments to make your treatments safer, your results better, and make your money go a whole lot further. So let's dive in. Number one, filler isn't permanent. This is a huge misconception that you're going to get filler, it's going to be permanent, you're going to be stuck that way, you're not going to like it, you're going to look fake. It's a huge misconception, and it's actually the opposite problem. Filler is temporary, and once you start getting filler, you'll realize you wish it was a little bit more permanent. You wish it lasts a little bit longer. Now, depending where it's placed, I recently did a couple of little reels on Facebook and Instagram to talk about, depending where it's placed, the product lasts a little bit longer, but your body will slowly break down this product from anywhere from 6 months to 2 years. So that means that your lips won't always look as big as they do the day that you inject them. Your cheeks will gradually lose volume again. Your jawline will soften again. And the goal isn't to do something one time to make you permanently different. The goal is to restore what you naturally lose as you age. So filler should be thought of kind of a slightly more permanent version of when you color your hair. You still need maintenance, not because something went wrong, but because time keeps on moving. So I often explain to people all the time about, procedures that produce collagen. You get to keep the collagen that you make, but the clock doesn't stop. That collagen keeps going away. You keep aging. And there's so much we can do to slow the aging process and to make our skin and our collagen production healthier. But filler is something that can be done as a maintenance plan to help maintain your youthfulness in your appearance. Some products are just hyaluronic acid-based products. Those are the most popular in the United States. Those are molecules that love water. They're water-loving molecules, and they hold on to water. They kind of mimic, I like to talk about them as mimicking fat because they're soft, they're squishy, pliable products. We can use some that are firmer in firmer areas of the face, or softer products in softer areas of the face, like the under eyes, very soft area. Even filling in little wrinkles to make them look more supported. Those are very soft products. And those soft products tend to be taken up by your body and broken down a little bit faster than those firmer products that are going to replace, like the cheeks need something firmer, and certainly very firm we need in the jawline where you want to carve out that jawline. So even though you're coming in and you're getting 2, 3, 4 syringes today, your maintenance plan isn't going to be 4 syringes. Your maintenance plan is going to be less than that. And it's not because something went wrong. It's not because your injector didn't place it properly. It's because the product gets absorbed slowly over time. Okay, so number 2 is going to get some people a little bit mad at me, but skincare is more important than Botox. Stick with me. Let me explain this to you. Filler is something that we do for our skin every single day. So if I could only choose one thing for youthful, healthy skin, I would choose great skincare before I would choose Botox. What Botox is going to do is it's an injection. It's going to relax the muscles, and that muscle movement moves the skin on top of the muscles. Repeated movements over time is causing that skin to crunch and form a wrinkle. Those wrinkles at first only show up with movement, and those are called dynamic wrinkles. But the more and more that you make that movement, those wrinkles become permanent or stuck, and we call those static wrinkles. So since Botox works on the muscles, it's not going to improve your sun damage. It's not going to repair your skin barrier. It's not going to fix your texture. It's not going to help you make more collagen, but your daily skincare routine can do all of those things. If you have a quality daily skincare routine, I'm talking a medical grade vitamin C, not some crap on the shelf that is clearanced out for a reason. Same thing with retinol, not some garbage retinol that's on the clearance shelf for a reason. Some quality growth factors and sunscreen every day. These things are quietly going to work behind the scenes, even while you sleep, to help you maintain that skin barrier, improve that sun damage, and help you with texture, help you make more collagen. Botox just can't do that. Botox is more like icing on the cake. It's something when we have great skincare or great cake in this analogy, then the skincare is going to maintain our skin, quality skin. And then when we get our Botox injections, that is just buying you time to really heal your skin. So when I have patients come into me and they have some serious stuck static wrinkles, which would be those lateral lines across your forehead or those deep lines in between your brows that we call glabellar lines or 11s, people call them. When we have those deep lines, yes, Botox is going to help. It's going to reduce that movement so that we can't keep making those wrinkles worse. But what we need to do when the Botox is on board, which is about 3 months, we have 3 months to do some heavy duty. Let's get into your skincare and let's heal that skin on top of the muscle so that when your Botox wears off, those lines don't come snapping back. So let's heal that skin. I'm off on a little bit of a rabbit trail, but that's also a wonderful time for you to add in a laser skin resurfacing when your Botox is on board at its peak. Then your brand new baby skin can come through and push out those old stuck wrinkles. So that's the time that you want to have your laser treatments. They're wonderful paired together. They're excellent on their own, but you put the two together and it's just a chef's kiss. Number 3 on my list of things I wish I could tell you without hurting your feelings is weight loss isn't magic. GLP medications have definitely changed medicine, especially weight loss medicine. They are helping millions of people lose weight that they could never lose, but they're not magic. All on their own, they're not your whole story. You still need protein, you still need movement, you still need hydration, you still need sleep. The medication is something that just opens the door. It's your tool to help you get where you want to be, but your habits are what are going to help you stay there. So when you get onto a weight loss program, if you're only focusing on, well, I'm on the shot and I'm gonna, I can be on 3 more doses before I hit the max or whatever, and I've lost 30 pounds, and once I lose another 15, then I'm going to hit my goal and I'm going to stop this shot. But in the meantime, we haven't made any changes. You haven't focused on increasing your water intake. You haven't realized that it's easier to move your body and gone out for more walks. You haven't started focusing on what you're putting on your plate. Then when you stop taking the medication, the door's going to slam shut on your progress and you're just going to go back the way that you came from. So habits are really something that we need to focus on. Something that we don't talk about often enough is that when we lose weight rapidly without adequate protein to support our muscles, that's when we see things like your appearance looks like you're more aged, your face looks emaciated, gaunt. That's what people are saying Ozempic faces is because all of a sudden rapid weight loss has caused sagging skin on the face. We're also seeing really thin hair, um, chunks of hair coming out, which is really, really stressful. And this is not this is not a sign of health. It is not a sign that the weight is coming off in a healthy way. These meds don't have to be scary. They don't have to be that story that we all know somebody who says, well, I know this coworker who went on that medication, lost a ton of weight, but now she's got super thin hair and she looks terrible and she's been in the ER a bunch of times throwing up. That doesn't have to be the story. The story can be something way more like, the medicine helped me quiet the food noise. It helped me lower my cholesterol, lower my blood pressure. It helped me focus on my diet. And you know what? I've been off the shop for 2 years and my weight hasn't changed, because when I was on the medicine, I used it as a tool so that I could maintain my healthy weight. That's the story that these meds really have the ability to tell. But unfortunately, right now, there's, I feel, two sides out there. It's one, oh, that shot makes people terribly sick and they lose all their hair and they look so gaunt and unhealthy. Or there's the story of, I've just started taking the shot and it's the only thing I've ever needed to lose weight and that's it. And it's the golden answer to everything. And I just feel like both of those are just not accurate of what this med does and what this med is capable of doing. And it's certainly not how we run our program at my medical spa. So that's my weight loss rant. And so that brings me to, cheap injectables often become expensive corrections. And that's because when you shop for anything, when you take the time to shop around for the absolute cheapest option, there's a reason it's the cheapest option. And sometimes when you buy something that's just so cheap and you end up having to put more into it to make it worth what you wanted, it can easily end up being the most expensive. I have a real life story about this that is not injectable related. My husband worked for a company for a while that made bathtubs, toilets, etc. And we went to an employee sale and we got this bathtub that looked gorgeous. They had a price tag on there that this thing was like over $10,000 for this bathtub. And we could get it for like $700 that day. And it wasn't brand new. It had been sitting out on the floor for people to look at. So it had a couple little scuffs in there, but I was like, you know what, I can get that out with a magic eraser. So we buy this bathtub. I'm so excited about it. It had air jets in it, and it was gonna like make a bubble bath for you. It wasn't like the kind that would massage you with the tub, but it had air jets in it to make this fun, bubbly, relaxing, glorious bathroom experience. So we buy this tub for like $700 and we get it home and we stick it in the garage. We call over a plumber and the plumber comes over and takes out our old tub and he goes to put the new tub in and he says, hey, where's a drain for this thing? And my husband and I are like, no idea what you're talking about, man. I'm not a plumber. So he's like, yeah. So when they took this tub and they put it on the show floor, they cut the drain out. They didn't just remove it. They left the pretty part on the top so we could see it. They cut the drain out. So if we want to make this tub work, I'm going to have to put a new drain in. So let's buy up a new drain. So we ordered our new drain, cost a couple $1,000. Get this new fancy drain in this new fancy tub that we thought was going to be all that. And then we have to pay the plumber his time to put this back in. So we do. And then get it all hooked up. And he says, all right, now, where do you want to put the blower for this? And we're like, what blower? And he's like, well, the thing that makes the bubbles come out of the tub. I need one of those. And it needs electricity, which we didn't think about. And we don't have electricity in that part of our bathroom. So now we got an electrician coming over to hook up some electricity in the bathroom, and holes being drilled in the tile and holes being drilled in the wall. And we have to buy the blower, by the way, which was also pretty expensive, over $1,000, and get that put in. And then it came time to pick out the faucet, and it turns out this fancy tub doesn't have the same like area to put a faucet as we thought it would, as our previous tub did. So we had to buy a little bit more fancy, a little bit more expensive faucet than we had planned on. So that like put us way over budget on this whole tub. And when it's all said and done, the tub is there and it works, and we loved it. But at the end of the day, we spent 3 times what we wanted to spend on that tub. And when we finally started using the tub and used that feature, the blower feature that makes the bubble bath, it was actually kind of noisy and not as relaxing as we thought it would be. So 90% of the time when we used the tub, we didn't actually use that blower feature after all. So just kind of like a little kick in the butt over, what we expected out of it and what we received out of it was just kind of a hard lesson learned in sometimes shopping for the cheapest option doesn't actually get you the same result. It gets you a couple of headaches along the way, and often ends up costing you more money than you had anticipated. And so for that reason, I say to you, when you see these crazy deals that are out there for injectors, think about it. Like, is this amazing price for Botox for $8 a unit? Is that because the injector's experienced and has time to fill her chair with severely discounted injectable? Or is that because the injector is really maybe not very experienced and trying to get a couple more faces under her belt so she has built up confidence? And if that is the case and you're okay with that, you know her personally, you're okay with saying, okay, if this doesn't work out, what's the backup plan? Are you going to help me? Are you going to straighten me out? Do you have a mentor that you can go to if this ends up a little bit crooked or something? What is the backup plan? And I understand that injectors are going to have that part of their career where they don't have as much support. I was there at one time, but I had a phenomenal support system. And if I would have had people that I treated end up incredibly crooked, I would have been able to fix it or have someone help me fix it. And now I'm that support for my injectors. So if my young injectors make somebody's eyebrow a little crooked or droopy brows or whatever it might be, they can lean on me to fix it. And my spa has the backup for my younger injectors to make things right for my patients so that nobody has to leave unhappy. And that's just my word of caution about the biggest deals that you find out there in injectables. Is I want you to think about it. You're not just paying for what comes in the syringe. You are paying for the hands that are holding it and the brain that is deciding where to put that product. Number 5 on my list of things I want my patients to know is that healing takes time. Unfortunately, with social media, it looks like you have this treatment and you immediately get these phenomenal results. You see these beautiful before and afters, and you don't see the in between. Most of the time, you don't see all of the things that were in between. Botox takes days, up to 2 weeks to be fully set. Filler can easily have a swollen week or two. It totally depends on the product and how it was placed and the area that was treated to see the final result of Botox and filler. Lasers can easily require weeks before your skin looks as incredible as it does in those after pictures. Collagen takes months to rebuild, whether we're stimulating collagen with microneedling or with laser treatment or with a product that is injected to stimulate collagen. Any of those procedures take time to build collagen, and that's because our bodies are healing, and your body can only heal so fast. There's some things that we can do to speed up healing, like adding some growth factors, drinking more water, using the appropriate aftercare. And we will guide our patients along the way on all of those things because we want them to heal as best and as fast as they can. But our bodies don't rush healing, so we shouldn't either. You gotta trust the process. Something that I'll say to my patients along the way, especially with filler, but also with lasers, is this can be an emotional process. When you came in today, You had smaller lips than after I injected a syringe of filler into them, and now you left, and the person you see in the mirror is a little bit different when you left than when you came in. And then you're going to go home and go to bed and wake up a little bit more swollen the next morning, and you might regret your decision. That's totally normal. And it's not permanent. The swelling is going to go down, but it can be so emotional. There can be waves of, I love this and I hate this. So I usually tell my patients, you can't love or hate your treatment for 2 weeks, because in most cases, 2 weeks is a good amount of time for the swelling to be settled and bruising to be subsiding, and to see the full result of what's going to happen from your Botox, from your filler. Lasers can take a smidge longer than 2 weeks, especially depending on the treatment, or they can take less, but don't love it or hate it within 2 weeks. Healing takes time, and we have to just slow down and let it happen. Next, I want to talk about prevention. Prevention is so much easier than correcting. I sort of touched on this when I was talking about filler before, but it's so much easier to do 1 syringe of filler today than it is for you to come see me in 5 years and require 4 or 5 syringes at a time. It's so much easier to maintain the quality of your skin and maintain the volume in your face with 1 syringe here and there than coming in years down the line and there's a whole bunch more skin laxity. There's a whole bunch more wrinkles that are those stuck wrinkles, those static wrinkles. It's so much harder to correct it after that time. It's so much easier to wear your sunscreen every day than it is to come back later with all kinds of sun damage that needs to be lifted with lasers, chemical peels, microneedlings, when you could today just be putting sunscreen in your makeup or in your primer or in your tinted sunscreen that is used as your moisturizer. It's so much easier to just throw on a little SPF every day than to catch up on that sun damage later. The skincare routine in your 30s is going to be so much easier than trying to correct decades of neglect in your 50s by just then starting to use good skincare. Aging isn't something that we can stop, but it's something that we can manage. And if we're doing that every single day by taking that opportunity to put on proper skincare and the things that your skin really needs in small, consistent investments, it's going to be so much easier than some dramatic fix in 5, 6, 10 years from now. So prevention, so much easier than correction, wins every day. And the last thing I want to just tell my patients, I've said this over and over on our Facebook, is that as your provider, I want you to look like you. I don't want to make you look fake. I don't want to give you giant cheeks or giant lips or some overly accentuated chin. That's not what I want. It's a huge myth in aesthetics that your providers want everyone to look the same, everyone to have the same shape of lips, or everyone to have massive cheeks. That's not what I want. That's not how the good providers practice aesthetics. I want you to look like you. And I tell my patients, I want you to look like you are just getting good sleep. You're drinking all your water. You look refreshed. I want your family to say, like, you look like you're glowing. You look like you've been getting good sleep. I don't want them to say it looks like you're loaded up with filler. That's not my goal. I want you to look natural and healthy and happy and like you. We're trying to make you look like your most refreshed version of yourself. And this is the type of work that is something that nobody really notices, which is also sometimes frustrating as the patient, because you're like, hey, I just spent $1,400 on this treatment and nobody said to me, hey, did you just get filler? But that's actually a compliment, because what people are asking you is, hey, did you get a new shirt? Did you color your hair? Did you get a new haircut? They can't put their finger on why you look so great, but they know that you look great, and that's the compliment. So that's what we want for our patients is we want them to look like they've just come back from this relaxing vacation, not the kind of vacation that you need a vacation from when you get home, but this relaxing vacation where they ate healthy food and drank water and got all kinds of rest. That is the success that your injector wants. So if there's one thing that you take away from all of this today, it's that the best aesthetic results don't come from a single treatment. They come from a relationship, one where the provider knows your face and the patient who trusts the process. It's a plan that's evolving with you as you age. Beauty isn't built in a day. It's built one thoughtful decision at a time. Thank you so much for listening to the Med Spa Method. If this episode answered a question that you've wondered about, share it with a friend or send it to someone that you know has been thinking about Botox or filler or skincare or lasers. It means so much to me when you guys share these episodes with your friends. It's just an incredible compliment. So I just want to thank you for being here today, and I'll see you in the next episode.